they are supposed to be almost of the same size. So you will see that the thickness of the wall will be larger in the artery than in the vein. So no kuri histology tubibona. Other differences is that in the vein we have valves, especially veins zo kuva wenda hasi y'umutwe gusubiza ku birenge. They have valves, and also other things we have internal. Of course, here we have internal and external elastic lamina, but in the artery, there's ones that they are elastic fibers. So we have elastic fibers in the arteries, but not in the veins. So byose ngaho muri histology, so and I think the cause impamvu Imana yazishyizemo ni ukubera ko iyo umutima uteye za mbaraga umutima wateranye zigomba kuba propagated throughout the arterial system kugira ngo ya blood pressure ibe kept, amaraso ashobore gukomeza gusunikwa. Niyo mpamvu elastic fibers muri arteries, muri vein ntabwo bikiri ngombwa. So that is the main difference. So the figure is again here. So the endothelium is composed. Okay, first of all, we have a tunica intima. So the tunica intima is composed of endothelium and the lamina propria. Then you have a tunica media, and we have muscles, and you have a tunica externa, which is a connective tissue. It is the one actually having small blood vessels, which will bring nutrients to the vessel wall itself. Nkuko coronary arteries zihari ku mutima, nanga tugira vessels vasorum. So on the capillaries, I think this we have seen it in the hemodynamic changes chapter. So this is a capillary. The wall is just composed of endothelial cells, no media, not tunica media, and because these are the epithelial cells, they don't need the blood supply. They will get nutrients through diffusion. But they have slits through which the fluid will escape to go outside, if this is at the arterial end, to bring oxygen and nutrients to the cells around. And then the slits on the venular end will be used to bring back the waste, if you can say so. So we have one way venous valves. One way kubera ko ni nka zira z'umutima zibuza amaraso gusubira inyuma, cyane cyane here I think this is like mu kuguru where we have two muscles and bundles and then a vein in between them. So these muscles that relax. If we start on the right side, when the muscles are contracted, zikanda amaraso ari muri iyi vene iri hagati yazo, no amaraso agahita azamuka, yashaka kumanuka agasanga hasi harimo valve zigahita ziyafunga cyangwa adasubira hasi. So iyo izi muscles zibaye relâché, relax as here, iyo no amaraso yari yatewe yazamutse hejuru ashigira tendance yo kugaruka inyuma, none agasanga indi valve ikurikiyeho igahita ifunga kugira ngo amaraso atagaruka hasi. So this is a normal situation. So when it is not so, nk'igihe hari ikibazo cya insufficiency of these valves, ntuzasanga umuntu arwaye varicose vein cyangwa varices. Bamwe bafite imitsi ibyimbye uyibona ku maguru, bakora akazi ko guhagarara bigatuma bahagarara igihe kinini and so on. So n'ibindi bibazo bishobora kubitera, cyangwa se abadamu batwite. So vascular pathology, there is vascularitis. Ngira ngo neno turibandaho, then turaza kuvuga no ku bindi bikeya birimo n'izi za varicose vein. So vascularitis, it means inflammation of the walls of the vessels. So it can be caused by a direct infection. So it's bacteria, rickettsia, spirochetes such as syphilis, kunda gufata cyane cyane nko muri aorta, iyo bita tertiary syphilis. Ngira ngo ndambiye nanga tertiary syphilis. Impamvu syphilis yamenyekanye uburyo iba primary, secondary and tertiary byatewe na n'ingorane abantu bagize. Hari ibintu bibi byagiye bibaho, ariko nyine nta kundi tubyigiraho, ariko byatumye hari ibyo tumenya, ariko ntabwo byari ngombwa ko biba ngo tumenye ko habaho primary, secondary, tertiary syphilis. So mu myaka y'igihumbi 1932 hari abantu reka tuvuge ko hari abantu banduye syphilis. Birashoboka ko bayitewe, ibyo wenda nta facts zihari, ariko facts hari nuko banduye syphilis ntibavurwa. Mu gice kimwe cy'Amerika nyamwitwa Tuskegee, so ntibavurwa nubwo abandi bavurwa, so abataravuwe n'abirabura, so ntibahawe imiti. So nyuma gato yaho mu myaka y'1940 havumbuwe umuti wa penicillin. Uwo muti ubasha syphilis cyane. So abandi bari barwaye syphilis baravurwa, abirabura ntibayihabwa. So birakomeza nyine ibibaho byose, complications, donc ni nka experiments babakoreraga. So biragenda hashira imyaka 40. Mu mwaka wa 1972 a medical student, just a medical student, not a medical doctor, umunyeshuri wigaga medicine gusa, ahantu hamwe asa kubibona hakiri umusore mutoya, ariko jewe hari ibintu nabonye ariko bidasobanutse. Bibaza kumwe mu bitanga seniors, abaganga bakuru, bamuhindura nyine ko ari umusukuru aho ngaho cyangwa ntacyo azi, ariko akomeza kugira curiosity. Aza kuganira n'umunyamakuru, umunyamakuru usanzwe wo kubajya ku banyamakuru b'imvaho cyangwa wende, amubwira icyo kibazo yabonye. Abanyamakuru mujya mubibona bakora inkuru, ibyo bita inkuru zicukumbuye. Aragenda nawe arashakisha amakuru, asanga nibyo, asanga abantu barwaye syphilis batigeze bahabwa imiti, batigeze bitabwaho, ahubwo barekerwa ahantu cyangwa banataha mu rugo bakabaha za rendezvous, ataba ngo babitaho kugira ngo bamenye ibigenda bibaho. So umunyamakuru yabyanditse mu kinyamakuru ngira ngo ni igisanzwe atari cya science, ngira ngo ni The New York Times, ntabwo nuko cyari. So abyanditse rero birasakuza. So leta Amerika ikorwa n'isoni, barabihagarika, ariko imyaka 40 yarishize. So abari bakiriho rero nibwo babonye, nibwo muzabona mu bitabo ngo syphilis y'umuntu ayifite ntavurwe. Nyuma y'umwaka umwe icyari primary syphilis nyine yafashe muri genital organs, iba yagiye gufata izindi organs, wenda uterus hejuru ari umugore cyangwa se abagabo bigafata mu zindi organs and so on. Hakaza no yita tertiary syphilis ifata vital organs za kure, aorta, ubwonko and so on. So ni cyo kitumye mbiza. So muzabibona cyangwa mubona muri course on ethics, research ethics. So ni zimwe mu ngero zabayeho abantu bagiye bakorerwa ibintu bya bunyamaswa mu byo twakwita research. So hari n'ibindi wenda muziga bya Nuremberg mu Budage. Nuremberg aho mu gihe cya genocide yakorerwaga Jews, abayuda nabo hari ibintu babakoreragaho nk'ibyo bya experiments and so on. So ni incidents zageze baho. Hariho niho byamenyekanye ko syphilis umuntu ayitindanye mu myaka igera kuri hafi 15 around there, igenda ikangiriza na vessels including the aorta and the vessels in the brain and so on. So ubwo byari binyuzemo, ariko that is how syphilis affected these vessels. So the first one, then direct infection. The second category of vasculitis is immunogenic, so immune complex mediated. So for example, infection induced. So in immunology, you understand this immune complex mediated. Immune complex ikorwa gute? Hari antigen umuntu asanganywe, yinjiye mu muntu adasanganywe, yinjiye ku muntu, it is like a foreign body. Noneho tuvuga umuntu arwaye hepatite B cyangwa C, uretse ibindi ibibazo bizitera ku mwijima, iragiye wenda umubiri uyikozeho antibody yirwaye, ya antibody iragiye igiye kurwana na ya antigen ubwanwa twahita hepatite B cyangwa C. Aho kuyirwanya biragiye biromatanya. Ni nk'uko waba ufite umusirikare wamwohereza kurwana, yagerayo akifatanya n'umwanzi. So iyo complex ubwayo ihita ibinduka umwanzi. Biranumvikana no muri monde politique. Uwari umusirikare wagiye akifatanya n'umwanzi, bombi n'ubundi wabanze. Naha rero iyo antibody igiye igafatana na antigen cyangwa umwanzi wari usanzwe wateye umubiri, bigafatana ya antibody avuga ngo yice umwanzi, ahubwo bikifatanya, bibyatana uko complex form. Umubiri no icyo cyose tugifata nk'umwanzi, ukohereza indi antibody yageraho nayo ikafataho. So bikaba binini no kugenda complex ziba. Uzumva ngo immune complexes ziragenda wenda zabaye aggregated muri glomeruli, zikuzura ahantu ku buryo zifunga na filtration. Ubundi antibody ikaba ari akantu gato cyane kagumye kuyifunga, ni gato cyane kagumye gufunga pores, ariko yabaye complex biba binini. So immune complex, it can be infection induced cyangwa izo muri systemic lupus erythematosus nayivuzeho kare, and it can be also drug induced, etc. So there are others, ANCA mediated, or this is also immunologic. So immunologic, we have immune complex, we have ANCA, this antinuclear cell antigen, antigen mediated. Direct antibody induced, mu ndwara nka Good-Foster syndromes na Kawasaki disease, aho umuntu akora antibodies against endothelial cells. Murabyumva, niyo umuntu akoze antibodies against endothelial cells, they will destroy endothelial cells with consequences. Endothelial cells, if they are injured, you know, there are like a small thrombosis which will happen and many other consequences. That is in Kawasaki disease. While in Good-Foster syndrome, there will be antibody against the glomerular basement membrane. And here you understand that kidneys will be the most affected. So they are cell mediated. Organ allograft rejection, for example, umuntu wahawe transplantation, transplant akenshi na rejection yayo iterwa n'iki? Iterwa nuko vessels zayo, icyambere umubiri ukora antibodies zo kurwanya ya transplant. Because transplant is a foreign body, it comes from another person. So the body recognizes it as a foreign thing, so it must kill it. Niyo mpamvu haba rejection. Mu kuhagarika rejection iyo ukoze transplantation, umuntu imiti itera weakening of his or her immune system. But usually it doesn't last for many years. So we have many other causes. So in general, in order for us to at least to have an overview of the vascularitis types, ugomba kuzibona in ugereranije n'uko vessel ingana. So there are diseases affecting large vessels, those affecting medium-sized vessels, those affecting small vessels, and those affecting very small vessels. So, and this diagram can help in that. So what are the diseases which can affect the large vessels, such as the aorta, the renal artery, cerebral artery, and the other major arteries? So here we have giant cell arteritis or temporal arteritis and Takayasu arteritis. So giant cell or temporal arteritis mu Gifaransa tuyita coronary disease, or maladie de Horner, not coronary disease. So maladie de Horner. So uzasanga umuntu afite temporal artery yarabyimbye, wayikora ukumva harimo utuntu tumeze nk'utunodwire bimurya cyane. So aba haribwa nka ibyo bita migraine, abantu baribwa umutwe w'ibimba cyane twa migraine. So biba byenda kumera kimwe, ariko we uyu nguyu wa maladie de Horner aba ukoraho ukumva ko harimo tunodire kuri artery. So then the medium-sized vessels hari bafatwa na polyarteritis nodosa and Kawasaki disease. Ndango Kawasaki tumaze kubibona hejuru ahangaha ni endothelial cells which are damaged by antibodies. So these are autoimmune diseases. So in the other medium size and small vessels, you have microscopic polyangiitis. Tukagira Wegener's granulomatosis and Churg-Strauss syndrome. So indwara nk'iyi Wegener's granulomatosis ivurwa mu buryo bw'uko kanseri zivurwa kubera so nagiye mbona abarwayi baze ko hano mu Rwanda ntawe ndabona, ariko iyo ifashe nko muri palate mu kanwa hagati ya oral cavity nazo cavity, akenshi irahashwanyura ku buryo habaho direct communication between the oral cavity and the nose. So kugira ngo azahavure akenshi radiation nk'uko babikora muri cancer. So then smaller vessels, you have many other diseases here. So this can help you to know if you have seen a disease affecting a large vessel, then there is a class or at least a small list of diseases, possible diseases. So I know there is a surgeon who is about to do his PhD in anatomy, and he will work on diseases. So vascular, if we start with the one affecting the larger vessels, which is the temporal arteritis. So is the most common form of systemic vasculitis, and in adults, it is acute or chronic, often with granulomas. So it's like granulomas is the when you palpate. And actually, when you do, you look at the microscope, you see giant cells like those you see in tuberculosis. So izo nodule nizo zigenda uretse ziba zaturutse kuri inflammation, chronic inflammation, granulomatous inflammation, which is in itself painful, inatuma amaraso adatambuka neza because they tend to subocclude the vascular lumen. So here you can see uyu muntu afite iveso ibyimbye, veso yose ibyimbye ntabwo ari temporal arteritis, aho igomba kuba imurya wanakora ukumva harimo nodules. That's how you will confirm it is temporal arteritis. So, and you see here we have a giant cells, as I was saying, and the lumen is narrowed, as I was saying, because of this chronic inflammation with granulomas. So it usually affects older patients. They will present with fever because of inflammation, fatigue, a loss of weight, with or without a partial pain and headache. So sometimes can affect the ophthalmic artery, bigatera diplopia. Diplopia ni ukuvuga igihe umuntu areba ikintu kimwe akakibonamo bibiri, this means two, or blindness of abrupt onset. So they have elevated erythrocyte segmentation rate. So you have seen this in hematology. Kandi bafata tibe bagashyiramo amaraso. So tibe zazarabugenda ntabwo ari bonetse yose. Noneho urareba nyuma y'isaha ukavuga ngo uzi ko amaraso afite hano agenda, amaseri yaramanuka, amazi agasigara hejuru, plasma igasigara hejuru. So iyo umuntu afite inflammation kizwi mu mubiri, iri generalized inflammation, nuko amaserire amanuka cyane byihuse ku buryo nyuma y'isaha umwe usanga yamanutseho milimetero nyinshi, ariko umuntu adafite inflammation amanuka utu milimetero duke. Niyo mpamvu uzasanga abantu erythrocyte sedimentation rate after 1 hour ni 2 millimeters, undi akavuga ni 10 millimeters. So ni uko iba high, ni ukuvuga ko umuntu afite high intensity inflammation. So diagnosis is by erythrocyte sedimentation. Niyo mu Gifaransa bita vitesse de sedimentation. And they do also biopsy to confirm that there are granulomas. So Takayasu mainly seen in females. The reason, the causes, the mechanism is not well known, but they think it is an autoimmune mechanism. So there will be manifestation, weakness of the pus in the upper extremities. Ocular manifestation and the weakness of the pulses in the upper extremities, reduced brachial pulse due to vascularitis in the arterial, in the aorta. So aorta niba yarafashwe birumvikana amaraso uko yanga azatambuke cyane cyane agere muri atari zo mu maboko bizagorana bitume blood pressure izaba yagabanutse. So it also can affect the pulmonary arteries in half of the cases, as well as coronary and renal arteries. And you understand if it affects coronary arteries, ni indwara ishobora gutuma umuntu agira ikintu kimeze nka angina pectoris, idatewe na atheroma, idatewe na atherosclerosis, cyangwa se akagira renal problems, insufficiency. So ikiranga ni iki rero, kubera ko nubwo twavuze ku maboko ntabwo akenshi ifata muri aorta ikiva mu mutima, ifata hamaze ko branching cyane cyane of the main arteries. So for example here in a normal condition, so iyi ni angiogram, iyo angiogram ni ukuvuga umuntu bamuteye contrast then bamukorera photo ni nka x-ray reka tuyite gutyo, noneho bakareba izi ni blood vessels, this is the aorta, the cross of the aorta, you can recognize it, then you have these arteries. So ikigaragara hano ni iki, this artery is this aorta is dilated. It is dilated because of reasons maybe. And here you can see that there is something which is occluding this vessel here. And here other vessels are not occluded as it is here. So this means that the blood which could go through here, it is being obstructed by this nodule. The consequences will be that niba iyi atari arija mu kuboko kw'indyo kuzagira blood pressure iri hasi cyane ujyanje n'ukuboko kw'ibumoso ko kudafite ziranode. So and that's why they say if there is a reduced brachial pulse and the difference in blood pressure between the left and the right arm is more than 10 milliliter mercury, aho ngaho uzatangira kwigenga. Of course with there's other findings that we have done. So on microscopy uzasanga afite inflammation cyane muri adventitia and the mid layer with involvement of the vascular. So iyi takayasu hari indi ndwara bitandukanye yo inflammation iba muri hafi muri lamina propria ikagera muri half of the media. Iyi ngiyo iri external, so adventitia with vascularum nizo za vessels zitunga larger vessel ubwayo, they are involved. So polyarteritis nodosa is the third category. So it has an onset from childhood, ariko ikagaragara cyane cyane umuntu ari gukura akuze. So it is associated with hepatitis B and C or both. So cyane cyane ko bayibonye kuri abantu bakoresha ibiyobyabwenge cyane cyane babyitera mu nshinge, yavuze ko nibo bakunze kuba barwaye hepatite B, sida na sida kubera baba basangira biriya bishinge nk'uko basangira ibiyoga. So probably immune complexes with antibodies. Sorry. So here antibodies will be complexed with the viral antigens, and they will be deposited in these inflamed cells. So as I said, it has a gradual onset. It means ibimenyetso yagenda duke twiyongera, and they are listed here. So diastolic pressure will be high, and they can have problems with some nerves. So if it is one nerve which is affected, this will be mononeuropathy. There are many nerves, it will be polyneuropathy. Purpura lividoricularis, abameze nk'afite utupeteshie ariko tukoze ibintu bimeze nka net cyangwa se nka nka supernet and so on. So gangrene, digital gangrene, meaning that the digitals ashobora kuba intoki cyangwa amano ntabwo bigeramo amaraso, then they undergo ischemia and necrosis. If there is renal involvement, the kidney will react by making sure the blood pressure is increased. In GI, there will be abdominal angina, angina pectoris, but in the abdomen because of the ischemia in the intestines. And if this lasts long, then the walls of the intestines will be weakened, they can undergo perforation, and so on. So diagnosis will be blood nitrogen, which will be increased. You can test and see if the patient has been affected by hepatitis B or C. So angiographic signs of aneurysm or vascular occlusion. So, but they say angiography is 60% sensitive. Ni ukuvuga ko mu bantu 100 bafite iyi ndwara, angiogram izabonamo 60 gusa, 40 ntabwo izabasha kubibona. So bivuga ko aneurysm cyangwa occlusion ntabwo urigeze ihita zigaragara. So on histology, you must see granulocytes or neutrophils in small or medium-sized vessels on biopsy. So they are treated using prednisolone. These are corticoids, anti-inflammatory corticoids, or cyclophosphamide. But when they are treated, they are only 10%, and you understand why? Because many organs, including vital organs, are affected. The kidneys are affected, the heart, and so on. So it is very risky. So those who are not treated, they can survive between 2 to 5 years. So urabona niba yafashe nko ku maguru, urabona ko because some muscles and the other soft tissues are no longer receiving enough blood, they undergo progressive necrosis. Ugasanga ni igisebe kidakira ahubwo kiyongera kwezamo tendon igaragara, amagufa akagaragara, and so on. So rimwe na rimwe bakagerageza muri surgery bagashyiraho graft. So graft ni nka transplant, ariko kenshi graft ibivuye kuri uruhu ku ruhande ugateraho n'ubundi bikanga, because vascularization there is not enough. So, and you see here, they are like larger nodules in this thing. So here you see the consequences in kidneys. We have some areas, wagira ngo zirimo pockets of blood, because there has been a necrosis in some areas. So this is the angiogram. This is a kidney again. So angiogram, urabona ko irerekana blood vessel, renal artery, its branches, but you see many nodules. So these nodules are the ones causing occlusion. And of course, there are smaller ones you cannot see, smaller nodules within small vessels. Okay, so any question about it? Polyarteritis nodosa. If not, then we proceed with Kawasaki disease, niyo twayibonye indi ifata ifata muri endothelial cells. So it affects endothelial cells. So it affects mainly coronary arteries, usually in children and infants. So most of the cases, 80% are less than 4 years old. It is the #1 acquired heart disease in the US and even in Japan. Acquired heart disease, not in general. So it's associated with cutaneous lymph node syndrome and acute and self-limited evolution. So self-limited evolution, when they say a disease is of self-limited evolution, nukuvuga ko ishobora iraza ikabaho ngaho signs and symptoms will disappear without any other treatment. So, okay, the picture is not enough, but it was showing changes in the palms. So the red eyes, dry cracked lips, and the red tongue. The sign, so this is a Japanese. So peeled off layers of the skin around the nails. So diagnosis, you will see that the neutrophils are increased. So this is leukocytosis, and the thrombocytosis, meaning that the platelets are increased. So some children will have this anti-nuclear cell antigens, antibodies in the plasma. So no bafite antibodies zirwanya the nuclei or the cytoplasmic components of their cells. So they have their hearts involved, and but this disease can usually resolve spontaneously without any complications, though mortality is seen in 2%. So microscopic polyangiitis. So we went from giant arteritis, ifata larger vessels. So we are going from larger vessels to smaller vessels. So microscopic also, it affects the microscopic vessels, microscopic polyangiitis. So it affects arterioles, capillaries, and venues. So similar than in polyarteritis nodosa twamaze kubona. And the regions are in the same stage. So palpable purpura, you will remember they are small hemorrhagic regions. The smallest, they are called the petechiae. Then the relatively larger ones are called the purpura. Then hemorrhage nini ikigaragara ni ecchymose and so on, and the hematoma and so on. So you can appreciate them here. These reddish lesions. So if it is a purpura, what you can call just a classic purpura will be just blood there, but it will not be palpable. But here the issue is that palpable, meaning that there are nodules with this purpura. So that is the difference between this palpable purpura and the classic purpura, just hemorrhagic. So clinically will be necrotizing glomerulonephritis. Necrotizing glomerulonephritis, we understand the consequences on kidney. Lungs, if it affects lungs, there will be hemoptysis. Hemoptysis, gukorora umuntu agacira amaraso, naho muzi ko kuruka amaraso ni hematemesis. So hematemesis and hemoptysis are different things. So joint arthralgia, weight loss in more than 70% of cases. Nerve damage would be seen izagaragazwa n'iki na numbness n'ibinya cyangwa tinglings, almost the same in limbs. So if it is there for a long time, there will be muscle wasting. Una muscle umuntu agira kugira ngo nukunanuka bisanzwe cyangwa yishyize kuri regime naho nibibazo. So purpura, again, here you can see on this abdomen and on the breast for this woman. Again, hemorrhage. So about 70% of the patients may have a clear relation with a recent immunologic reaction to an antigen. So nukuvuga ko kunako abantu bagize allergy ku kintu runaka. It can be a microorganism, it can be on drugs, or they can have antibodies, antigens from the tumors they have developed. So they have a positive anchor, plasma anchors. So microscopic polyangiitis is quite similar histologically to polyangiitis nodosa we saw previously. They have the similar microscopic change, except that the muscular or larger arteries are usually spared. So you remember in anatomy, the largest arteries they're called elastic arteries. So aorta and its main branches. So izikurikira bazita muscular kubera ko zitaba zifite a lot of elastic fibers in their tunica media. So that's why here when they say muscular artery, that is what they refer to. So going to Churg-Strauss syndrome, iyi ni indwara igaragara ku bantu bafite allergie cyane cyane asthma, bakunze kuyigira n'ibindi bijyana nayo. and irangwa na eosinophilia. You remember in a general pathology inflammation that the people who have allergy or who have parasitic infection, they have their eosinophils increased. So eosinophilic granulomatosis, vasculitis, and perivascularitis. So kugira granulomoeosinophils ni kimwe, ariko kuba biri muri the wall of the vessels nicyo kizatuma umuntu avuga ko afite Chog-Strauss syndrome. So sometimes we have such disease. I remember at Sashika we have a case. We have not yet given the final diagnosis. Twasanze afite granulomas, eosinophilic granulomas, but they don't affect the vessels. So we have not yet given the diagnosis. We are still reading and also we are consulting our colleagues abroad to see what could be. Ariko kimwe twaketse Kimura disease, which also has a which has a eosinophilic aggregation. To check a parasitic infection, then we do a special stain. It became negative, so it is not a parasitic. So it can be Chog-Strauss syndrome, it can be Kimura disease, and so on. So we will see probably next week. So meaning that usually to say this, to have eosinophilic granulomatosis, it doesn't mean automatically it's Chog-Strauss syndrome. It can be any other disease which have the same features. So wegenous granulomatosis, yango nayivuzeho gakeya ikunda, at least to me, abarwayi nagiye mbona n'abarwayi gifata muri head and neck area. So those doing dental surgery will be more interested in that. Ariko n'abandi kubera ko iyi ni indwara uzayamubona muri ahantu hatari dental surgeon, you are the one to take care of them. So it is quite a very difficult disease to treat. Kwa kumugwa araza wenda afite isebe idakira mu kanwa cyangwa amazuru, then uko bitinda ugasanga noneho hagatoboka burundu. So you understand the consequences. Yari kurya birazamuka, many issues. So this granulomatosis will cause the glomerulonephritis caused by vaginous granulomatosis will cause hematuria, meaning blood in urine, and the proteinuria, meaning the loss of protein within the glomeruli, and so on, and the rapid progressive glomerulonephritis. Then this will lead to the renal failure. So this is not just a simple disease. It is systemic. It affects many organs. Kandi bigaterwa n'umuntu. So haruigira bigafata head and neck, indi bigafata muri kidney, akaba byibasira ni kimwe na systemic lupus erythematosus. Okay, so this is the lung showing areas such as this necrosis. So another disease, Buerger disease. Also, it is called thromboangiitis obliterans. Ilango iyo ikintu mwayibukiraho nuko itera ibyo bita claudication. Claudication ni ukuvuga umurwayi uyifite asa n'agize ischemia mu maguru yari kugenda. Tuvuga ari kugenda akaribwa mu maguru agahita yica kwa yakuribwa. Ischemia iraryana. So when cells are suffering because of lack of oxygen or nutrients, it causes pain. So akicara yakwicara bigatuza kubera ko at least vessels ziri guhitisha amaraso make yatuma muscles n'izindi structures zikomeza kubaho, ariko wakora ibituma amaraso akenewe yiyongera, then zikongera zigasufura. So bayita intermittent claudication. Rero ni nuko aribwa intermittent bitewe nuko aruhutse cyangwa se ari kugenda, bayita gutyo. So ni nayo yita rero Buerger's disease cyangwa thromboangiitis obliterans. So segmental thrombosis and the acute and chronic inflammation of medium-sized and small arteries, mostly in tibia and radio arteries. So birumvikana. Apparently bikunda kugaragara ku bantu banywa itabi cyane, because they have endothelial cell hypersensitivity. So they are also, there is it is seen mu bantu bari muri izi groupe z'amaraso HLA A9 and B5 and so on. So hano igaragara cyane ni muri Japan, Israel, India, so in Asia most. So microscopically, there will be acute and chronic inflammation in the vessels with some thrombosis. So the thrombosis contain a microabscesses. Microabscesses ni ukuvuga usanga harimo utuntu tumeze nk'amashyira. So it can extend to the veins and the nerves. So the later complication will be ulceration of the toes and the fingers, which will cause a gangrene. So as I was saying, there is a claudication in the feet and your hands, sometimes centrally radiated, numbness, tingling, and the Raynaud phenomenon, and so on. So that's all for the arteries. So for the veins, we go to the veins now. And as I said, we did not discuss about the tumors. They will be discussed in other chapters. So in veins, the most common diseases, they are varicose veins. We have a thrombophlebitis and phlebothrombosis. So aya magambo kuyandika gutya bifite impamvu yayo. Agizwe n'ibintu bibiri cyangwa bitatu. Thrombo ni thrombus cyangwa blood clot. Phleb, it means vein. Itis is inflammation. So ahangaha no kuvuga ko habanje thrombosis hanyuma itera inflammation of the vein. Ahangaha ni opposite. Habanje phlebitis ikurikirwa na thrombosis. So ijambo ryabanje agace k'ijambo kabanje gasobanura what came first. So phlebitis here came before thrombosis. So phlebitis caused the thrombosis. While in this scenario here, the thrombosis is the one which induced the inflammation, the phlebitis. So we have also superior cava vena syndrome and the inferior vena cava syndrome. No questions so far for arteries? Okay, so as I was saying, for the varicose veins to happen, someone needs to have his or her valves insufficient. Ni ukuvuga ko valve ntabwo zishobora gufata amaraso igihe asubiye inyuma hasi ngo ziyahagarike, ahubwo arakomeza akagenda agasubira inyuma, noneho uko asubira inyuma agera ahantu akibumba, nibwo uzasanga ubona ko afite utuntu tumeze nk'utubyimba kuri za veins ze uzibona zigaragara, as you see on this person. So I think this is in normal way. So amaraso arazamuka, yamaze kuzamuka akanyura muri valve isa n'iyifunze, akaba ahagaze, hazaho indi muvoma, amaraso none akazamuka, valve ikifunga. Iyo valve itifunga agasubira inyuma, nibyo insufficiency which will lead to varices. So clinically I think nta muntu utabibona n'utarize abazi kuzireba izo arizo varicose veins. So nicyo twavuga kuri veins cyane cyane. Ngira ngo ariko hari igihe tubifata nk'ibyoroshye, ariko just a few months ago I was just amazed. Hari umwe abarwayi bacu babanze kujya muri traditional healers. So yagiye muri traditional healers bamwe ba gakondo batageze no mu ishuri akenshi, baramubwira ngo afite, so yateye ko afite hemorrhoid. So hemorrhoid is a type of varices. Hemorrhoid nuko ziba zafashe kuri anus and genital organs, otherwise they are varices. So baramubwira ngo bakabona ashobora kuba afite nk'igikanseri, niko kugira urwaza kwa muganga. Ageze kwa muganga muri district hospital, bamwohereza no muri provincial hospital, aho hose bo baravuga ngo barabona ari varices, barabona iyo hemorrhoid nta kindi kibazo kirimo. Then umurwayi ntiyashirwaza kuri teaching hospital bakora biopsy, then we found it was a cancer. So what amazed me ni ukuba traditional healer yabaye yarashoboye kubona diagnosis, ariko abaganga yanyuzeho bose kuva muri centre de santé ya kuri provincial hospital bo bakivugira ibindi. This is the complication of varicose vein. bakunda kugira ibisebe kandi ntibikira. iri sere ulcers zakomotse kuri varicose veins ntabwo kuzivura byoroshye. So aneurysm, I think will not take too much time because we have covered this in general pathology. You know that this is an abnormal dilation of an artery or a vein caused by a weakened vessel wall. It can be caused by congenital defects, systemic diseases, atherosclerosis, infection, or trauma. So atherosclerotic aneurysm ni yatewe na aneurysm na atherosclerosis, ibintu byumvikana. And nkuko nabivuga kare, aneurysm of the abdominal aorta ishobora kuba above the renal arteries cyane cyane, cyangwa se ikaba hafi ya bifurcation of the femoral arteries. So this is just a reminder about the atherosclerosis, that this is a disease of the intima, which causes narrowing or occlusion of the vessel, caliber or lumen, or it causes weakness of the wall, which can bring to aneurysm or a rupture of that vessel. So just a reminder about the histology. So this is the lumen. Then we have this intima, which is composed of endothelial cells, and this is the lamina propria. So the lamina propria would be separated from the tunica media by internal elastic lamina, and we have an external elastic lamina here in arteries. So veins, they don't have these elastic fibers. So as you have seen atherosclerosis, so there are changes which happen in a vessel with atherosclerosis, but the symptoms will happen if there is either occlusion, which is at 90% of the caliber, or if there are changes which happen on the atheroma, such as the rupture, such as erosion or ulceration, and so on, or thrombosis. So the major components of the plaque, they are cells such as smooth muscle cells, macrophages, and the other white blood cells. There is a extracellular matrix, collagen, elastin, prostaglandins, proteoglycans, lipids such as cholesterol, which can be intracellular, engulfed by the macrophages, and because usually it is too much, some of it also is not engulfed and is the one inducing more inflammation, or usually calcification because of too much cholesterol. So the major processes in plaque formation, we have seen that there is intimal thickening and lipid accumulation. So the process are here, I think this you had seen it in general pathology. So for embolism, we have seen the types. We have a thrombus, the one arising from thrombosis, from the bone marrow, especially femur fracture, fracture the femur, bakunze kugira iki kibazo. Then bone marrow embolism ni kimwe nayo, it is a type of fat embolism. Therefore, muri bone marrow mu bantu bakuze harimo fat. Hematopoietic cells ziba zikirimo ni duke cyane, ko hematopoiesis in adults takes place in iliac bones. Na sternum ahandi ntayo bigira. Air embolism nabisobanuye iyo muteye abantu serum cyangwa muhaye amaraso bigashira ntimubifunge, ahubwo n'umwuka kwinjiramo, nicyo kishobora kuba ku murwayi. Amniotic fluid, mu gihe umudamu abyara, and foreign body also can happen. So, and the most deadly thing one of the most deadly is pulmonary embolism. Ni ukuvuga umuntu agize cyane cyane ahangaha ikintu kibitera n'umuntu ugira thrombi in deep veins of the legs. Ibi biba kuki ku muntu uba stagnant, uba ahantu hamwe igihe kinini ari immobile, nk'umuntu babaze, irazwi cyane cyane babazwa mu nda ahagana hasi, bagira iyi risk. So uko amaraso aba stagnant mu maguru, biroroshye ko agira thrombosis, then that thrombus will be carried out mu maguru, akazamuka muri vena cava mu mutima, then umutima ukohereza mu bihaha, ahita agira pulmonary embolism. So unfortunately nta barwayi bakunda guhita bapfa, ariko I gave you examples y'abantu bashoboye kubaho, hari n'uwo nzi twabonaga tubana muri korali cyangwa twabonaga muri korali y'Ubutare, ariko ameze neza. So we yari yagize nyuma yari hashize igihe kitari kinini abyaye. So then are diseases which can usually they are deadly, but sometimes you can save someone. So the venous thrombosis and the pulmonary embolism especially happens in prolonged bed rest. I was explaining immobilization of extremity, congestive heart failure, following trauma, burns, fracture, surgery, and so on. So ni ukuvuga ko rero igihe ufite umurwayi nk'uyu uryamye igihe kinini, cyane cyane wabazwe, bino bakuru wabazwe cyane cyane mu nda mu maguru, n'ubundi kumukora movement ni ikintu nta nubwo nayo kiba kidashoboka, but as soon as possible abagomba gukoreshwa zamuvamo. Niyo mpamvu gukorana na physiotherapist ari ingenzi. So ntabwo ugomba kuzumva ko umurwayi n'uwanjye nta wundi uzamukoraho, no. It is a multidisciplinary profession. Ntabwo ibintu byose wabyikorera, you just have to keep in mind ko ukeneye umuntu ukamubaga ukavuga uti jye baza uyu muntu, kandi kubera ko namukoreye abdominal surgery, ukamenya ko afite risk yo kugira thrombosis and pulmonary embolism, then hakiri kare ukabwira physiotherapist uti wowe ni specialty yawe, uzi ibyo ukora, uyu muntu yabazwe gutya na gutya, ugomba umenye ko mu gihe gikwiriye udakerewe utangira kumukoresha kinesiotherapy kugira ngo atazagira ibyo bibazo. Nawe ntabwo ahita aza gukora umunsi wamubaze cyangwa ejo, ariko nyuma y'iminsi 3 ashobora kumukoresha utuntu dukeya. So that's how you have to collaborate with others. So this was a case of fatal pulmonary embolism. Ni ukuvuga ibi ni blood clot bakuye muri pulmonary arteries igihe bari kumukorera autopsy. So on this picture, this is a dilated pulmonary artery. Murabona muko harimo ikintu kikimase kibumbemo, yango ni umugozi. So it is a blood clot yakomotse ahandi iraza igera hariya, ubundi hiti hafunga. So aba n'abarwayi baribwa cyane ku buryo bukomeye, buryo ntabwo ari ikintu ashobora guhisha, baribwa ndetse akenshi bahita basa n'abajya muri koma ku buryo byinshi atanabimenya. And you should also keep in mind that things are always changing. Igihe cyashize twumvaga ari indwara zenda bino ahangaha cyangwa zishobora kuboneka gake cyane, nta nubwo twabitindagaho, ariko ubu we start to see that diseases of the Western population are becoming more and more here in Rwanda, probably because we adopt the Western lifestyle. Birashoboka. So niyo mpamvu yari za stroke, ari ibiki byose bigaragara ko ari byinshi. Igihe twigaga ntabwo afaga kuva ngo umuntu afite stroke, ariko ubu ngubu hafi buri munsi ubona umurwayi wundi wa stroke. So things are changing there. Ni ukuvuga ko habit cyangwa se ibintu twari twaramenyereye twebwe si byo mugomba kumenyera. You must consider that the society is changing a lot. So any question? Because we are done. So this is the same diagram I had shown. Any question?
No question, lecture.
Okay, so you answered to mine then. So we come back on this question that we had on cardiac pathology. So I think now here we have to answer this fourth statement. Claudication in the feet and the hands is associated with which of the diseases here?
I think it is thromboangiitis.
Thromboangiitis obliterans. Yes, you are correct. Thank you. So it is 4 is associated with E, thromboangiitis obliterans. So Wegener's granulomatosis twabonye ko ifata ahandi cyane cyane kidneys, oral cavity and so on. Nizo items zari zisigaye hano. Okay. So a 1-year-old man is working on the ungrounded electrical wiring in his house. He has not flipped the circuit breaker switch to the off position. So urumva ko yafashwe n'umuriro. He accidentally touches the bare black wire of a 110 volt 20 ampere circuit. Which of the following is most likely to be the major life-threatening problem associated with this event? Muri rusange umuriro iyo wishe umuntu ubwo ni nkacyo kibazo kibarirwa aha ngaha. Ikintu utera ni iki gituma umuntu apfa? Unyunyuza amaraso cyangwa se utera uramutwika nk'utwitswe n'umuriro w'ubushyuhe atari w'amashanyarazi. Ni iki kimwica? Irimo na redima. Na redima ishobora kuba ifata umwanya munini kandi umuriro umwica akanya gato. Hyperthermia bitewe n'iki? Cardiac arrhythmia, vascular thrombosis. So what would be the answer? Anyone to give us the answer?
Okay, thank you, sir. I think it's cardiac arrhythmia.
Okay. Okay, cardiac arrhythmia is electricity is known to cause the cardiac arrhythmia among other things. So of course sometimes it causes thermal burns. Ariko nk'abantu nagiye mbona bishwe n'amashanyarazi ukakora utobusi akenshi usanga ushobora kumara amasaha menshi ushakisha ku ruhu ikimenyetso yuko ari amashanyarazi. Kuko iyo bamuzanye hari ubwo baba bamwishe bakavuga ngo ni amashanyarazi kandi wenda bamwishe cyangwa bamuhaye ibintu bimwica yabiri cyangwa binyuma. So usanga ari akantu gato cyane yahiye ku ruhu gato cyane kaba kahiye kukabona kenshi birakugora. Ariko gasanga umutima niwe wari wagize ikibazo. So is the cardiac arrhythmia, as you said. Don't know if you see that the color has changed much on it did. So a 77-year-old man with decreasing mental function has developed increasing dyspnea for the past 3 years. So it is a long-standing. On physical examination, he has a diastolic murmur, not to systolic. So icyo bivuga iki? Ariko ntibatubwiye niba ari kuri mitral valve area cyangwa niba ari kuri tricuspid valve area. A chest X-ray, a chest CT scan shows an enlarged heart and a prominent aorta. He dies with complications of pneumonia. At autopsy, the thoracic aorta is aneurysmally dilated. Microscopic section of the aorta shows chronic inflammation and the luminal narrowing of vasa vasorum of the aorta, of course. There is a disruption of the aortic medial elastic fibers. Which of the following conditions is most likely to cause these findings? So is it hypercholesterolemia? Is it Marfan syndrome? Is it polyarteritis nodosa, Takayasu arteritis, tertiary syphilis, ANCA-associated vascularitis? So this is an aorta. So does polyarteritis nodosa affect larger vessels or medium-sized vessels? That's one. Kugira ngo ubashe kuyitamo n'urugero. So hypercholesterolemia, maybe here we are referring to atherosclerosis. Someone to answer? So Marfan syndrome usiye kwigaragara ahantu henshi, ariko ikimwe izwiho nuko ituma ahantu hari kuba smooth muscles ziba deficient, ikunda kugaragara muri organs nka urethra cyangwa ureta, ugasanga smooth muscles making the wall they are absent, hakiyiziramo utundi fibers duke, bigatuma habaho weakness of the wall. Maybe that's why they brought it here. So that Marfan syndrome can affect many tissues, many organs which have smooth muscle. Someone to answer? You are quiet. Okay, ubwo tugakerekera kizaza kindi. What is the tertiary syphilis nyango biri kugaragara hari? That's why when I started I talked about syphilis and the ethical issues in the US. Okay, so that's all for this presentation. Do you have any question? But you said there are no questions. So how do we proceed? What are you doing in the afternoon?